comes to you from the Africa Centers for Disease Control and Prevention. And Dr. John Nkengasong, the director of that institution, is here as usual with his brief on the pandemic as well as progress on the vaccination front. When we do come to the question and answer session, please use that WhatsApp number +251 9455 2310. That's +251 9455 2310. You may also come to us live on this Zoom platform, as well as utilize the question and answer section. We are coming to you in English and Portuguese, so in English and French, so please feel free to choose the language of your choice. Well, without much further ado, let me invite in the director of the Africa CDC, Dr. John Nkengasong, for his usual briefing. Dr. John, you have the floor.
Thank you, Wayne. And let me join you in extending my apologies to our colleagues that have joined this platform with us. I was called into an emergency meeting of our ambassadors, who are kind of our parliamentarians or our Congress people, depending on which system you live in. And that the topics of the day, that is access to vaccines, and the issues that we'll be discussing here are also preoccupying them. So they needed to have a very detailed briefing, which took an extended period of time, which we couldn't cut them short because they represent our member states. So my sincere apology for that delay. So let me, as usual, start by thanking you for always coming to this platform for us to discuss issues of our time, which I think history will record that this moment we're dealing with here is a trying moment for the continent and for the whole world. And there's no other way of describing that other than those challenges of our times. So I just want to start unusually today by providing some clarity on the remarks that I made last week, which were reported differently regarding AstraZeneca. And I fully understand that when we communicate on this platform, people may receive the information differently. And all I ask is that if there's challenges in understanding, I'm always available to clarify based on the timing of the topic. So let me just remind everyone that Africa CDC continues to recommend the use of AstraZeneca vaccine. So noting that the benefits of the AstraZeneca COVID-19 vaccine continue to outweigh the risk. And the clarification I wanted to make here is very simple, that the process of acquiring vaccines from limited sources, as we've all discussed in this forum, is extremely complex. So in January, we were in discussions with the Serum Institute in India, and we agreed that they will supply us with the doses of vaccines that we announced at that time, but we didn't sign any contract with them. Then it became clear that we were dealing with the same source of vaccine with COVAX, and we just didn't want to get into that competition with COVAX, which on all the vaccines were coming to the continent. So we said, good, means we have not signed any contracts with them. We will shift and find additional doses of vaccine. Remember, we always want to achieve 60% of our target, and COVAX was trying to get us 20%. We were trying to get additional doses from Johnson & Johnson. So we shifted our strategy and to Johnson & Johnson, and while leaving the COVAX mechanism to work with the Serum Institute, because we also noted that the Serum Institute was not going to have enough doses to support all of our needs. So I think there's very clearly there's not been any shift, or we didn't dump at all or drop our engagements with the Serum Institute. Just the best way to put it is this: if they have vaccines at the Serum Institute today, we'll be happy to get them. Okay, so that is very, very clearly what I just wanted to remind everybody and clarify that. Again, in the spirit of addressing a very complex situation that is unfolding in front of our eyes every day, is really to just reach out if you have a question for clarity. We'll be happy to address that appropriately. So let me now go into the epidemiological situation. As we speak today, the continent has recorded 4.3 million cases of COVID-19, of which about 116,000 deaths have occurred, representing a case fatality rate of 2.7%. So that rate, that 2.7% represents about 4% of the global total. If you look at the countries, again, that are contributing more than 60% of the cases, they include South Africa, Morocco, Tunisia, Ethiopia, and Egypt. And again, the global case fatality rate is about 2.2%. And 38 countries in Africa, that is 38% of our member states, representing 21 countries, are reporting a case fatality ratio that is above 2.2%. So let us now look at the situation with respect to the changes over the last 1 week. Over the last 1 week, we've seen the following trends. There is a week between what we call the epidemiological week 14 and 13. We've seen the following changes. New cases represents 78,000 across the continent. Those are new cases, of course, and this represents a 2% decrease compared to last week. When you now look at the different regions, the 5 regions, you see that the Northern Africa region has reported 35% of new cases, East Africa 34%, Southern Africa 15%, West Africa 8%, and Central Africa 8%. Then if you look at our the following 5 countries that are reporting the highest number of new cases, they include Ethiopia, Tunisia, Kenya, South Africa, and Egypt. So let's look at the deaths. In terms of new deaths, again, comparing last week and this week, we observed that we recorded 1,866 new deaths, and this represents an 8% decrease compared to last week. When we now look at the 4 weeks and ask ourselves the question, what is the trend over that period? And the period ranged from March 15 to April 11. We observed that there's a 2% average increase in new cases across the continent. Again, 2% average increase across the continent. That reflects that if you take everything and dump it together, but we need to disaggregate that to see the trends. So if you do that, what do you see by region? First, you have 11% increase in Northern Africa, 10% increase in Eastern Africa, absolutely no change in Central Africa, 8% decrease in Southern Africa, and 12% decrease in Western Africa. Then if you look at the deaths, you see that over the last 4 weeks, we have observed 2% average decrease in new deaths, and the distribution by most populous countries include 47% average increase in Kenya, 16% average increase in Ethiopia, 2% average decrease in Egypt, 7% average decrease in DRC, 12% average decrease in South Africa, and 45% average decrease in Nigeria. Now let's turn our attention to testing. To date, nearly 42 million tests have been conducted across the continent, and this represents a 2.4% increase with respect to last week. As of today, a total positivity rate of 10.2% and a test per case ratio of 10 have been reported across the continent. Nearly over 10,000 people were trained on antigen testing in 17 member states alone. And so I think we are making progress with respect to rolling out the antigen test, which we believe is going to be a game changer and in addressing our COVID needs. Over 700 antigen test sites for COVID-19 have been set up, and a total of 2.5 million antigen tests have been conducted in member states. In other capacity development areas, we have about 110,000 antigen test kits were distributed to 6 member states over the last week, and that includes Zimbabwe, Sudan, Sierra Leone, Kenya, South Africa, and South Sudan through the support from Global Affairs in Canada. So with respect to vaccine updates, on the 14th of April, the Africa CDC published a statement following the reports of blood clot events that led to a temporary pause by the US government, that is the US FDA and the US CDC, on the use of the Johnson & Johnson vaccine. The Janssen COVID-19 vaccine, as it's called, is presently only used in South Africa out of the 55 member states, with almost 290,000 doses administered. The country has not registered any reports of blood clot and thrombosis following the vaccination, according to the reports we have from the government of South Africa. However, on the 13th of April, the government of South Africa announced that the country will also temporarily pause the rollout of the vaccines as a precautionary measure as they review the situation. I just want to state here that in the United States, out of the 6.6 million people that have been vaccinated, 6 of them developed those the blood clotting phenomenon. And that represents 1 in 1 million vaccinations. I just want to be sure that we put that in context. We will be monitoring the situation very, very carefully with the US CDC, the US FDA, and the government of South Africa to understand more what the findings will look like. What I think they are doing now is basic detailed epidemiological analysis to understand who has been affected, how they were affected, what age group is it, and all those parameters. And they will unpack that, and they will be able to give us a decision on what how to move forward with that vaccine. Remember, this was a very similar scenario of what we had and observed with the AstraZeneca vaccine in Europe, and which there was a temporary pause to that, and then subsequently the governments of the European Union decided to move that forward. The government of the Democratic Republic of Congo announced yesterday that the country will finally launch the national COVID-19 vaccine campaign on April 19, and which was initially suspended due to, again, issues related to the side effects of the AstraZeneca. This past Monday and Tuesday, some of you, or most of you, were all on the platform where Chairperson Musa Faki Mohammed, the chairperson of the African Union Commission, convened a high-level meeting that was also chaired by His Excellency Felix Tshisekedi, who is the rotating chair of the African Union, to really preside over a high-level conference on Africa's vaccine manufacturing for health security. I'm really pleased with how the meeting went. There were over 90 speakers, including head of states spoke from all over the world, from 70 countries. We were able to record a cumulative attendance of 40,000 participants. So again, that ensures that it highlights that this topic was long overdue. We needed to actually elevate it. And there were 2 major outcomes from this meeting. One was the launch of the African Vaccine Manufacturing Partnership, we call Partnership for Africa's Vaccine Manufacturing, PAM, by President Tshisekedi, and which will really build the right partnerships around technology transfer, knowledge transfer, manufacturing, that is infrastructure and regulatory. And in the coming days, a lot of that will be put up, including a task force that will drive that process forward. The second thing that happened was really that a framework and a roadmap on how to roll out this vaccine manufacturing on the continent will be released in the coming weeks. And just again, in the spirit of that partnership, it was very clear that this topic was receiving the appropriate attention. The Africa CDC and the Coalition for Epidemic Innovation, in abbreviation CEPI, signed an MOU to bolster the partnership. That was really a strong commitment of how to move PAM forward. That is the partnership for Africa's vaccine manufacturing. We also saw that the Afri-Exim Bank and African Finance Corporation also signed a partnership to advance vaccine manufacturing on the continent of Africa. So I think that is all very, very good news in the right direction. So in the coming days, we'll continue to provide you with information on how that partnership will evolve and if we are making very specific progress. We really hope that the momentum that we have would make us and enable us to use a stepwise approach to engaging the 5 regions in a way that we set up the appropriate vaccine manufacturing site. Our target is simple, that in the next 20 years, we should be able to move away from importing 99% of our vaccines to importing only about 40% of our vaccines, which means we should be able to, through this partnership, to manufacture ourselves about 60% of our vaccines over a 20 years period of time. It is an ambitious program, but we have to be ambitious to ensure our vaccine and health security of the continent. Let me just then discuss 2 things, then I'll conclude. One is that as of the 12th of April, a total of 34.6 million vaccine doses have been acquired by member states, with approximately 13.9 million doses having been administered. Morocco and some of the breakdown include Morocco 8.6 million doses, Nigeria close to 1 million, Ghana 680 doses have been administered on the continent so far. So really strong uptake for Morocco's 8.6 million, Nigeria close to 1 million, Ghana 680 million. So again, this suggests that if we have the vaccines, the rollout can actually occur pretty quickly. So as of today, 32 member states have received their consignment of COVID-19 vaccines from the COVAX facility, with 12 additional countries receiving allocations through AVAC. Thank you, and over to you. Again, my sincere apologies for starting 10 minutes late today.
Thank you very much, John. We move straight into our questions, and the first one is coming from Samuel Buri, and Samuel is with the Swiss Public Radio. Now, he wants to know the number of vaccine doses that have been allocated by the African Union and to how many African countries so far. I know you touched on that right at the end of your briefing, but let me join that with a question from John McDermott. And John says, given what Dr. Nkengasong said at the start of his presentation, could Africa CDC reconfirm how many vaccines have been bought via the African Union? Which ones are they? Have contracts been signed? And when are these vaccines supposed to arrive? So those are 2 very similar questions coming from Samuel Buri and from John McDermott.
So very good questions. I think the first is respect to the only vaccines that AVAC has distributed are those vaccines that came from the MTN donations to a few countries. And this were all the AstraZeneca vaccines, which we bought from South Africa. And since we really don't have a continuity of acquiring the AstraZeneca vaccines because of the situation in India, I mean, that is all for now that we have distributed to our member states. That is the 12 countries that received the AVAC vaccines. So with respect to John, your question about how many vaccines? Let me just be very, very clear. We have signed a contract with Johnson & Johnson for 220 million doses of vaccines, with an option of getting an additional 180 million doses of vaccines if need be, going forward. Now, in terms of delivery, we are projected that the delivery will start the third quarter, okay, and July or so. If we have early deliveries, fine, we'll make that available to countries. That is what, so if you consider that the 220 doses plus the 180 million doses, that all of that will be uptake, then you are referring to about 400 million doses. That is where we are. Previously, we were in discussion because in this vaccine negotiation, which I'm learning a lot with the experts that deals with negotiation, you agree and you sign a contract. In January, we had agreed with the Serum Institute that we acquired the 270 million doses of it, as I said, and that led to the announcement with President Ramaphosa. The vaccine terrain is extremely complex. I mean, and you negotiate today, tomorrow the company is not in a position to deliver, and you can't sign. Until you sign a contract, you have no vaccines. So what we have actually signed now is with the Johnson & Johnson. So I think that is what I explained earlier today. So I'll leave it at that. So 220 million doses of vaccines from Johnson & Johnson with an option of acquiring an additional 180 million. And the delivery time point is beginning third quarter of this year.
All right, so thank you very much. Let's say good morning to Paul Adepoju. And Paul is with the Lancet, and he has questions on vaccines as well as Ebola. Good morning, Paul.
Hello, good morning, and thank you, Dr. John. And let me say congratulations on the vaccine conference. It was quite thorough. So my first question has to do with the Ebola outbreak. And the first question is regarding the recent finding that a new outbreak originated from someone infected back in 2014-2016 pandemic. What are the implications for stigmatization and people coming forward, especially medical workers working? So what are the implications of that? And especially with COVID-19 putting public health in general light. So what is being done to address this? And the second question is, what is the latest timeline regarding COVID-19 vaccine availability in Africa? You were initially concerned about vaccine hesitancy, but in several African countries, they're already exhausting the doses that they have. So has there been strong evidence to support the impact of vaccine assistance in Africa, or were the initial worries no longer a major concern? Thank you very much.
No, thank you, Paul, and thank you for taking the time to attend the vaccine conference, which I really hope will be a turning point in our ability for our continent to ensure its health security through vaccine security, diagnostic security, and therapeutic security. And that is what we are calling a new public health order, which was also discussed abundantly by President Tshisekedi and other panelists. I think we have really embracing a new public health order, which is really underpinned by ability to think boldly, to think bigger, and to think to build back better the continent. I mean, that is, we will be driving that agenda very, very aggressively for our continent going forward. Now, with respect to the two other things you raised, that is stigmatization, the findings in Guinea, where this outbreak seemed to have occurred, is extremely concerning. And it also makes the situation very worrying, which means once an Ebola outbreak is declared over, we need to monitor people that were infected for over a very long period of time and do even in-depth analysis of where the virus might be hiding. We know that there are certain components of the body, like semen, where the virus seems to be hiding and can persist for long. Viral persistence is not a new phenomenon. mean, in HIV, I work in HIV research for 29 years, and one of the greatest challenge you have with HIV is that it hides in those compartments of the body that you can't find it, and where drugs cannot get access to. So I think it's a new development, but it also points to the fact that you should never claim that you know these microorganisms well, because there will be always be surprises there for all of us. So that the stigmatization comes with our ability to understand what we are dealing with. I believe that it only suggests to us that in public health, we need to prioritize behavioral scientists to engage in the fight against unknown diseases, so that they can truly understand what the community is thinking, what their concerns are, and their fears are. The first reaction of a human being is fear when you are dealing with the unknown. And when you are dealing with an unknown disease like Ebola or COVID-19, I think it always starts with stigmatization, and you don't want to go next to somebody who has been a victim, and even with all this. So it only tells us that we need to do a better job as public health experts to communicate with the community, engage the community so that they lead the response, own the response, and actually be part of the entire response. So it is work in progress that we hope to look at what is unfolding in West Africa with additional research and support that as much as possible. With respect to vaccine hesitancy, I'm extremely encouraged by what we are seeing with respect to vaccine uptake in Morocco, with respect to vaccine uptake in Mauritius, Seychelles, Rwanda, and Ghana. They've exhausted the initial doses of vaccines that came in there. So again, any study that we did a few months ago is a snapshot of the situation. So what you want to do subsequently is to do another study to see if behaviors are changing. And my submission or thesis is that with time, when people see the benefit of these vaccines, more people would like to get the vaccines. I think that is, that is a hypothesis that I'm putting up there, and I think that early indicators would suggest that. But it doesn't mean that all components of the community will be taking those vaccines. It also suggests that we have a lot of work to do to really understand the community, who is taking the vaccine, who is hesitant to take the vaccine, and where should we focus our efforts to actually do more work to get the community engaged and improve our risk communication components.
We have questions, one question coming from Claire Keaton, and Claire says, I'm with the Sunday Times in South Africa. And she says, what is the Africa CDC's response to the pause on the J&J COVID-19 vaccine rollout in South Africa following the FDA recommended pause in the US? You have already explained to us that we will be talking to the FDA to get their further analysis on that issue, but perhaps you can talk to the issue of whether we are still recommending for this vaccine to be done in Africa.
Let me repeat what I said. I mean, South Africa has not observed any individuals with side effects from the Johnson & Johnson vaccine. So I think that is extremely important take-home message. And I also indicated that as a country, they have actually vaccinated about 290,000 people and have not identified any one with the blood clotting effect. So I think that is an important observation. What South Africa did, I believe, was also in line with what you call extra precautionary measures, while waiting to see what the United States will do, because they have the largest number of people that have been vaccinated with the Johnson & Johnson vaccine. So in the coming days, we'll be able to, as Africa CDC, issue a more directive guidance on the Johnson & Johnson vaccine.
All right, Maggie Fick from Reuters says, does Dr. Nkengasong have any further comment on how the African Union's COVID-19 immunization plans may be affected by the pause in the J&J vaccinations in the United States. And then also, does he have any update on the African Union's plans to purchase Sputnik doses, given that in February, he said that Russia had offered 300 million doses and a financing package. And then finally, Maggie says, what about talks with Sinopharm? Are there any updates on purchasing plans?
So all very good questions. The Johnson & Johnson, I will just caution that we wait and see just in a couple of days. I'm very optimistic that the situation will be clarified by the United States Food and Drug Administration, as well as the United States Centers for Disease Control and Prevention. So they will be analyzing the data, as I said, and would base our own finding on what, and recommendation based on what they are seeing. Let's cross that bridge when we get there. I mean, it's of no use now to be making projection on what will happen to our plan or not. Let's just be patient and wait for that. With respect to the Sputnik vaccine, remember we said very precisely that 300 million doses of the Sputnik vaccine were available and so there are two things. Let me just be very, very clear here. There is the financing of the 220 million plus 180 million doses of vaccines from Johnson & Johnson that is being financed or pre-financed by the Afri-Exim Bank, period. Then the Sputnik vaccines are available on an individual bilateral basis. If countries want to get those vaccines, they can negotiate with them and get it through the platform, which is very different from saying that we are pre-financing the vaccines. I don't know if this makes sense. I think, yes, that is what the understanding with the Sputnik vaccine for now. So I think those were the two questions that came from Reuters, correct?
Let me just confirm on that. Those were questions from Paul, from Magnific. I think so. I think you've captured the questions fully. Thank you very much. Let's move on. We now have questions that have come up on our WhatsApp group. And this one is from Peter Fabricius, who is with the Daily Maverick in South Africa. So he says, hi, Dr. John. What is the current vaccine shortfall in Africa? And apart from South Africa, which other countries are making vaccines on the continent?
So apart from South Africa, we know and we learned during just before the vaccine conference on Monday and Tuesday that Algeria is working with Russia to start producing the Sputnik vaccines in Algeria. We haven't seen the details of that. And that will be very encouraging news to see how local manufacturing is occurring on the continent. Besides South Africa, that at the Aspen facility in Port Elizabeth that are producing the Johnson & Johnson doses, which, by the way, that is where all our doses will come from. You have other countries that have their capacity and capabilities to produce other vaccines. The Pasteur Institute in Senegal has been producing yellow fever vaccines for many years. We have sites in Morocco, the Pasteur Institute in Morocco, in Tunis, Egypt, all produce different kinds of vaccines, not necessarily COVID-19 vaccines. I think that is the understanding. The continent also has the ability and has been producing animal vaccines across many countries. I think that is, we are hoping that the partnership for Africa's vaccine manufacturing will catalyze and galvanize that movement so that even countries that are producing animal vaccines can repurpose and actually focus on that. A technology like the messenger RNA, as you heard during the 2 days forum, really offers a tremendous platform to leapfrog the continent's ability to manufacture vaccines. I think that is something that we are really going to be looking into aggressively to see how we can forge those partnerships to move forward. We're very pleased that nearly all those, the CEOs and senior representatives from some of those companies that produce the messenger RNA vaccines were on the platform, and really very open to a dialogue in that direction. So we remain very optimistic that our scenario on the continent may actually improve over the next coming months or even years.
All right, we have two very similar comments, which I'm going to be grouping together for you. So the first one is coming from Della Russell, and Della is in Ghana with the Daily Graphic. She says, Dr. John, in Ghana, many of us who received the first dose of the AstraZeneca vaccine are presently within the 8-week period within which we are supposed to receive the second dose. That, however, is yet to happen owing to the unavailability of vaccines. Some health experts are reported to have said that the first dose could guarantee an 11-month protection for those who have taken it. Is the protection period accurate, or should the public begin to be worried? So that is from Della Russell from the Daily Graphic. And let me join that with a question from Judith Akolo, who has a very similar question. And Judith is with the Kenya Broadcasting Corporation. So Judith says, Dr. Nkengasong has just said that there is no continuity in the delivery of AstraZeneca vaccines from India. So what happens to those people who have already received the first dose and are expected to receive the second dose in 12 weeks?
No, thank you. I think that absolutely no need to be worried now because these vaccines are prime boost, which means that you receive the first dose, your immune system or your body reacts to it, and it really begins to offer even protection. And then the second one is really a booster, and it's where it doesn't. I mean, we don't know that if you delay it by a couple of months or weeks, it will impair the ability to boost it when you get the second dose. I don't think so. It's just that it doesn't give you that full range of your immune system reacting and getting ready to fight the virus once you get exposed to it and infected. But you can already be assured that with the first dose, you are getting already some protection from the virus from developing disease. I think not necessarily from infection, but from developing disease. So that is, we'll just wait. Now, let me be very clear with that, the second part of this, which is with no guarantees of a second dose. What we are saying is clearly, and I really want this to be captured, that India has put a restriction on export of the vaccines because of the rising second wave. And we don't know when that restriction will end. It could be that in the coming days, due to different channels of communications and engagement with COVAX. Remember, the India doses were secured by COVAX, okay, in Geneva. So I'm sure they are in discussions with them. We are also in discussions using diplomatic channels through to get in touch with the government of India. So if in question of, and I really want to pause here and say that I really want to believe that the government of India will lift those restrictions as soon as possible, given that you cannot, India is not an island. If you finish vaccinating your people before Africa or other parts of the world, you have not done yourself any justice because variants will emerge and might undermine your own vaccination efforts in India. So I really want to be very sure that the narrative is that we don't know when vaccines, you get the second doses, but rather that India has put a restriction, and we are working to make sure that India lifts the restriction, and then the second doses will be distributed by COVAX across the continent. So again, no reason to be worried. It's not like when you get vaccinated with the first shot, then after 8 weeks you don't get it, then your first shot was not useful. No, that is not how immunology works at all. I mean, the second dose, if you measure your immunology reaction, they really almost explode. And I think that is like in the Ebola vaccines, I mean, the much more time you delayed, the better even the protection was. So, but again, we are dealing with the COVID vaccines that we don't know a lot about the long-term durability of immunity, but I would absolutely say that there is no need to be worried for the delay for now. We just hope that the Serum Institute and the government of India will release the vaccines as soon as possible.
Thank you for that reassurance. We move on now to Peter Mwai, and Peter is with the BBC. So Peter says, we have seen reports that the Malawi government will destroy more than 16,000 COVID-19 vaccines which had not been administered by the listed expiry date on Tuesday. The doses are from among the 102,000 that had been sent to the country through the African Union. What is your reaction to this? And also, what is the status of expiry of doses being distributed under John, I'm not sure if you fully captured that. We seemed to have a technical problem. Can I repeat it for you?
Yeah, yes, please.
All right. So I was reading a question from Peter Mwai from the BBC. So he was saying, we have seen reports that the Malawi government will destroy more than 16,000 COVID-19 vaccines which had not been administered by the listed expiry date on Tuesday. The doses are from 102,000 that had been sent to the country through the African Union. So what is the status of expiry of the doses being distributed under the African Union? And is there risk for more doses going to waste?
So thank you, Peter. That is a very good question. I mean, the first thing I would say is we are in an emergency. We are in a crisis. We are in a pandemic. So we really want to believe that when we do these extraordinary efforts, which is really time-consuming, we are dealing with a landscape of vaccines that it is not because you have the money that you can get the vaccines. They just, access to the vaccines is just not there until such a time that the pipeline will be more flexible and available. So if we, as Africa's Union, Africa's CDC, work hard to deliver those vaccines free of charge to countries, we are doing that with the expectation that they will get organized and really use the vaccines quickly to vaccinate people that are in need of it. And there are many out there that are in need of it. Let me just give you an example. The countries in the Caribbean are also on the platform, and they requested us to send them those vaccines, which we did, and they mobilized and used up all of their vaccines. Togo mobilized and got their vaccines used up almost immediately, and as well as Ghana and others. So we really expect that should be, you do your own part and I do my part of it. So the expiring date of the vaccines was the expiring date as indicated on the vial was April 13. And the countries got those vaccines about 3 weeks before, so which is, and not large numbers of doses. These are the 200,000, 10,000 here and there, because again, these are from the MTN donations, which we took from South Africa and distributed as part of our really efforts to continue to do our best to ease the situation. So we really were expecting that those who had received the vaccines use the vaccine. If you put out a call that you have 200,000 doses of vaccines to be distributed in a capital city, I'm sure within a couple of days, those vaccines will be gone. So on top of that, the Serum Institute had indicated clearly, and they said a letter that I can share with everyone who is interested, that the tentative expiring date on the 13th was really extended due to biological analysis to around June or July. But we just didn't want to go with the second, that extension. And we have documentation for this, Peter, that we can share with you. And we were pushing countries to say, look, you are receiving the vaccines 3 weeks to the first expiring date, the 13th of April. Do your best to immunize, because there are not a large number of vaccines that were shipped out there. So that's all I can say. I've not seen the reports from Malawi, and I've not heard from other countries that as to how much they have used and how much they have not used.
All right, thank you very much, John. Lawrence Caramel from Le Monde says, how are the variants spreading across the continent? Do you have new figures about that? And then he asks, secondly, how are you moving forward with Tanzania in terms of assisting them with the pandemic? So those are two questions from Lawrence Caramel.
So, Laura, with respect to the variant, the situation has not changed a lot on the continent. We still have 19 countries that have reported the presence of the B117 and 18 countries that have reported the presence of the B1351 variant. So it has not changed. Now, it doesn't mean that the variants are not spreading. It only means that the data that we are seeing suggests to that. So that is very important to note. With respect to the second question, which I will ask your Wayne to repeat, that will be very helpful.
Lawrence was asking how we are moving forward in terms of assisting Tanzania with to COVID-19.
Yeah. No, absolutely. I mean, we are very open to supporting Tanzania. We have actually, hopefully, in the coming days and weeks, be more clear with our engagement with Tanzania. I just ask that you bear with us as we go through the process to re-engage with Tanzania. I think in the coming days or weeks, I will come back to you with some more clarity.
All right. Sarah Jerving from Devex says, how much does the Sputnik vaccine cost per dose on the African Union's platform? And how much per dose will the Johnson & Johnson vaccine cost?
The Sputnik vaccine is going to be costing a total of about $20 for the two shots. It's like $9.5 per the two doses of the vaccines that are required. The Johnson & Johnson doses will be $10 per shot, and of course it's a single dose vaccine. So that is the information that I can share with you at this point.
All right, thank you. Let's go to colleagues who are online. I see a hand up from Ambassador John Mfasoni. Good morning, Ambassador. Ambassador Mfasoni. Okay, Ambassador is not able to come through to us. Let me take some hands from colleagues who've asked questions before, starting with Peter. Peter, do you have a new question that you want to put to us?
Yeah, can you hear me?
Yes, please go ahead.
Sorry, Dr. John, sorry to bother, but I had two questions before, and I think you skipped the second one. Was just to get your sense, ballpark figure of the vaccine shortage on the continent. I know that's difficult because of timelines and so on, but just some sense of it. What is the backlog? I mean, there is a backlog which you've referred to in passing and obliquely before last week, for example. But I'm just trying to get a number.
No, thank you, Peter. That is a very good question. So let's start with let's do the math together. I mean, we are looking to immunize about 750 million people on the continent. So let's stick with the people immunized, because that is what is more important for us, not the doses. So let me start with, as I say, charity begins at home. We at AVAC are saying that if we concretize our doses, that is 220 million from Johnson & Johnson plus an optional 180 million, that brings us to 400 million people in Africa that could be immunized, okay? So again, just make a mental note of 750 million people. So that is one thing to note of. Then the second thing is what we are going to receive from COVAX. COVAX is saying you receive about 600 to 700 million doses. Doses, not people immunized. So you divide that by 2. So if you take the lower number, it gives you 300 million people immunized. Okay, so I think, so we are dealing with a ballpark, as you say, in a very optimistic scenario. So if you add the 400 million people that will be immunized, you're here making very aggressive assumptions that 400 million doses will be acquired through our contract, and then that 400 million shots will go into the arm of an African. Then you add that to a 300 million that you're getting from COVAX, assuming that you're taking a low number, even if you take the higher number of 750 million, 700 million doses, divide that by 2, it gives you 350. Then you can actually say that you're immunizing 750 million people. Okay, that is the situation. Now, are we actually going to have that? Different scenarios will come in. One is, will COVAX be ready? It would be able to deliver its 700 million doses, and by when? The second thing you have to factor in is, will countries, we've signed the agreements with Johnson & Johnson for 220 million plus 180 optional. Will countries come in and pre-order their vaccines so that you get all of that? If they do all of that, in what I call the best case scenario, then you get your 750 million people vaccinated in the next 2 years. I don't know, Peter, if I answer your question.
All right. Thank you very much. I'm sure Peter is satisfied.
Yeah, I am. Thank you.
Thank you very much, Peter, for that. Let's take another question from Paul Adepoju. This is our second from last question. So very quickly, Paul Adepoju says, I have a question on tracking side effects of COVID-19 vaccines that have been administered so far in Africa. What is in place to be absolutely sure that the side effects are quickly identified, especially in African countries with weak systems to track every vaccine recipient?
Paul, thank you. We at Africa CDC have already conceive a system of what we call pharmacovigilance, okay, which is essentially monitoring of these side effects by countries, what you call surveillance for side effects, for events, as the experts will say. And the World Health Organization in Brazzaville, they're also doing that actively, doing that. In the coming weeks, we will be putting in place a very robust system across regions that would make sure that we do that on a very continuous basis to capture those events. I mean, look, Paul, we will be in this business for the next 2 years or 3 years. So we have to have those systems in place to really track not just adverse effects, but also the longevity of the immunity of the vaccines that we will be receiving. The issue is so important to not pay attention to. So, but we will bring you up-to-date information on 2 things. One is what systems will be putting in place across all 5 regions to track any side effects, what we call pharmacovigilance, and also what systems will be put in place to track the longevity of immunity of the vaccines as people administer. By longevity of that, we mean if you get a vaccine today, how long would it protect you? Would it protect you for 1 year or 2 years? And that will inform the question as to whether we need to do yearly vaccinations or we only need to do a single vaccines for a long period of time, maybe 2 years or 3 years.
All right, so let's go to Esther Nakazi, who's come through to us on our WhatsApp platform. And she says that she starts with an observation that in most countries, my question is, most countries have expanded the initial target of vaccination among their populations. And then she says, by this time, at least all health workers from countries that got vaccines should have been covered. Do we know if this has happened? Do we know if all health workers have now been vaccinated?
I can only say that most healthcare workers have been vaccinated, but I cannot give you the exact numbers. That data exists, and we'll be happy to analyze that and bring that to you. But I will not be in a position to give you information that has not been fully verified. We want to be sure that we look at that carefully to see exactly by country how many healthcare workers have been vaccinated. You also depend on your definition of healthcare workers. If we are limiting that only to hospitals with nurses and doctors, you can almost say that most of them have been. But if you're expanding that to those in the community and responders, then it becomes a little bit tricky. But that data exists, and we'll be happy to synthesize that and share with you if it's of interest.
All right. My producer says, let's take one more question, and that is from Maggie Fick. Maggie, good morning. Please go ahead with your question. And you are from Reuters.
Good morning. Thank you so much, Dr. Nkengasong, for your time. And our questions were on Ghana. They have administered 742,000 doses of the 815,000 they had received from COVAX MTN in India. So they're going to run out by the end of next week and would need to secure doses for second shots. We were just wondering if you had any update on Ghana and on the delivery of doses, anything further to say about countries waiting for shots so that they can give the second dose. And also another question on expiration of vaccines. We know that South Sudan doses have expired. Should those be thrown away or can they still be used? Thanks so much.
So thank you so much for that question. And again, let's start with a positive thing in Ghana. Is really, as you already said, of the doses that they receive, they use up. I mean, if I do my maths carefully, almost in excess of 80% of those have been used. 70 to 80% of that have been used, which is a very good thing. Most of those doses came from the COVAX facility. And as I said, I know I'm being repetitive here, that those doses came from the Serum Institute in India. And the situation unless India release those doses, which, as I indicated earlier, multiple channels of communications are being used to engage the government of India and Serum Institute, it will be difficult to predict when they will get the second doses. Not just Ghana. I mean, most countries are in that. Most countries that who receive their first doses will be in that situation. It is absolutely not because of COVID not wanting to deliver or not able to deliver is the source of the vaccines. I said earlier, and I'll repeat, that even if Ghana have the money, you don't know where to go get the vaccines. That is the challenge we are in. That is where we have been. And that's what we have been saying all along, that we are in a bind as a continent, that there's access to vaccines has been limited for us as a continent and is affecting the way in which we roll out our vaccination program. I think that is very, very obvious. That we are in a situation that we cannot predict when the second doses will come, and that is not good for our vaccination program, that we needed to vaccinate at scale and with speed. So it's not a routine immunization program to fight a pandemic. So I think that is that. With respect to the expiration date, which I said earlier, that we had for the doses that we submit, we send, given how limited they were, that if you use the first expiration date, everybody would have been able to use those vaccines a long time ago, which is 3 weeks ago that they were distributed. And then there's a letter that came from the Serum Institute, and which I will be happy to share that with you. If you wish to see that, the Serum Institute did a secondary analysis and said you can extend the expiration date to July 13 or so. I would be happy to share that with you. But just to avoid any misunderstanding, misconception, we were very insistent that use the vaccines before the first expiration date. So that's all I can say at this point with respect to those vaccines that were shipped and are being used. We are in a very, very dicey situation of access to vaccines and availability of vaccines. I would make an appeal to all countries that if you have your vaccines, use them. I mean, use them up quickly and don't delay it. It's not just about the vaccines that are distributed, but the COVID vaccines will definitely have an expiration date. And again, act like Ghana, like Rwanda, Mauritius, others, use your vaccines as quickly as possible. And I'm sure that if we do that, we'll not be running into issues of the expiration date or not, given the urgency of the situation, given how quickly we need to roll out vaccinations, and given the speed at which we need to roll out the vaccinations.
All right, thank you very much, Dr. John Nkengasong. Please, can you give us your final comments of the key highlights from today?
So my key highlight today, Wayne, will be that of patient, that we should be patient with this, what I call an evolving vaccine situation with respect to what I call the first wave of vaccines and vaccinations on the continent and in the world. We were just last week or 2 weeks ago discussing the AstraZeneca situation, and this week we are discussing the Johnson & Johnson situation. I remain hopeful and optimistic that what the FDA and the US CDC will find will not be so serious as to completely halt the use of the vaccine. You also have read a press release from Johnson & Johnson also delaying the rollout of their vaccination programs in Europe. I remain again hopeful, optimistic that the findings will be very limited with respect to the severity of the side effects that will enable us to move forward with this the vaccination programs in Africa. But again, my message always is we are in this together. We are in this with the media. You have to work. We have to work with you as much as possible to engage the community, so that we provide the truth behind everything and build trust and move forward this and work this journey, long journey forward together with all of you. Thank you, Wayne, for the work you are doing to coordinate these press conferences every week.
Thank you very much, John. Well, that was Dr. John Nkengasong, and he is the director of the Africa Centers for Disease Control and Prevention at the African Union. And that summary brings to an end our press briefing for today. Let me just apologize once again for the lateness in starting by a few minutes. And that was because Dr. John had to attend to issues being raised by member states of the African Union through their permanent representatives in Addis Ababa. So thank you again for your patience and for your availability week in, week out, colleagues, to join us for this briefing. As usual, we'll meet again next week on Thursday at the same time. Bye-bye for now.
Thank you.